Your Royal Highness, Minister Fayot, Your Excellencies, High jury members, finalists, ladies and gentlemen from the financial inclusion sector all around the world, welcome to this hybrid edition of the European Microfinance Award. We are so pleased that we can celebrate again in person as well as online. So welcome to all those joining us via online, and welcome to our audience here at the European Convention Centre in Luxembourg. This ceremony will be held mainly in English, but also partially in French and in Spanish, and therefore a simultaneous translation is available. You can choose your language at the bottom of your screen on the left-hand side. Number 1 is for the floor, the ceremony without translation. Number 2 is for English. Le numéro 3, c'est pour le français. And 4 for French. The 2021 edition of the European Microfinance Award is jointly organized by the Directorate for Development and Cooperation and Humanitarian Affairs of Luxembourg's Ministry of Foreign and European Affairs, the European Microfinance Platform, and the Inclusive Finance Network Luxembourg. This year's topic is inclusive finance and healthcare. The importance of finance in human development is well established and at the forefront of international development efforts. The United Nations Sustainable Development Goals clearly link health outcomes to risk protection for poor households. So paying for healthcare in low-income countries is the biggest financial risk facing poor households, and the problem here is twofold. First, accessing and affording even basic day-to-day care may be extremely difficult, and second, even when an injury or an illness was treated, the financial burden can cast a huge shadow for years to come. And therefore, this year's European Microfinance Award highlights initiatives that facilitate access to quality and affordable healthcare for low-income communities. Yes, and the European Microfinance Award is an initiative of the Luxembourg government and for the Directorate of Development, Cooperation and Humanitarian Affairs. Financial inclusion is an important tool for poverty alleviation, and the prestigious prize rewards the winner with €100,000 and 2 runners-up with €10,000 each. And today's welcoming address is given by Luxembourg's Minister for Development, Cooperation and Humanitarian Affairs, Frans Fayot. In his speech, he will highlight the importance of financial services to improve the access to healthcare.
Royal Highness, dear Mr. Churchill, members of the High Jury, Excellencies, honorable guests, dear friends. The European Microfinance Award not only provides us with a unique opportunity to draw the attention of the larger financial sector to specific challenges, but it also highlights the crucial role inclusive finance plays in promoting access to finance to the greater audience. Even though I would have much preferred to welcome you in person, I am happy that so many of you have joined us today in this hybrid event. Ladies and gentlemen, as outlined in the general strategy of Luxembourg's development cooperation and in our recent innovative and inclusive finance strategy, microfinance remains a key priority for us. Providing new opportunities for the financially excluded is a precondition to building more resilient economies, even more so after this unprecedented sanitary crisis. The role of microfinance in alleviating poverty and poor health services is undeniable. A better use of healthcare and stronger healthcare systems are measurable results of microfinance health programs. In that sense, inclusive finance is key for achieving the SDGs. Luxembourg has become a center of excellence in inclusive finance over the years, providing targeted support to developing countries. This ecosystem includes, amongst others, the European Microfinance Platform, the Inclusive Finance Network, and the European Investment Bank, all of whom co-organized this event. This year's theme is Inclusive Finance and Healthcare, and we are using this platform to promote initiatives that help low-income communities access quality and affordable healthcare services. This shows that the microfinance industry is capable of moving beyond its original core area. Health is a conditio sine qua non to leading a good life. If it is not given, you are quickly at risk to enter a vicious cycle of poverty, which leads to bad health, which again increases the risks of poverty. In fact, sickness, or rather the fact of being uninsured, is one of the most frequent reasons for repayment problems and source of debt among low-income clients. Good health, on the contrary, is a catalyst for economic development. Providing healthcare services means to lay the foundations for people to escape poverty. Many initiatives and projects in the health sector have matured in recent years, while newer ideas are being tested. Adding a health component to a microcredit service, like a health loan, is probably the most widespread model. But there is more to it, such as health education, access to affordable treatment and other health services, capacity building, to name only a few examples. Many microfinance institutions are also using digital solutions in order to increase their outreach. This allows us to reach communities in remote areas, often lacking access to treatment as well as the financial means to pay for it. The gaps of physical access to high quality, universal health care and to financial services, like a bank account to save money for medical expenditure or health insurance, are challenges which must be tackled urgently. When talking about a health crisis of unprecedented magnitude, I'm not only talking about COVID, but also about preventable diseases. The financially excluded do not only need better access to healthcare, but also the ability to pay for it. If traditional insurers are reluctant to extend healthcare coverage to the people in need, we need to step up our game with more innovative solutions. And this is where today's finalists come in. Their ideas for providing access to health services and the necessary financial means support the most vulnerable populations. And I'm particularly proud that all three projects have a high percentage of female clientele. This shows how women can lift themselves out of poverty thanks to access to financial services in an autonomous and self-determined way. Everyone should by now be aware of the importance of investment into healthcare systems. With the economic consequences of COVID, we need, now more than ever, innovative solutions enabling access to health services for the most financially excluded, especially young people and women. Ladies and gentlemen, Her Royal Highness the Grand Duchess will announce the winner of this year's award in a few minutes. I can tell you that this year's discussions at the High Jury were particularly long, as the decision was not an easy one. The three candidates are doing an excellent job, as you will be able to convince yourselves in the portraits that will be shown now. Enjoy the rest of the ceremony.
Yes, and we will. Thank you, Minister Fayot. Our first expert voice today is known as Dr. T in her home country. She is a South African medical doctor, a women's rights and sexual and reproductive health a rights activist, and she has an impressive resume. Dr. Thalang Mofokeng is a medical doctor with an expertise advocating for universal health access, HIV care, youth-friendly services, and family planning. She has been a commissioner at the Commission for Gender Equality in South Africa, and since 2020, she's the United Nations Special Rapporteur on the right of everyone to physical and mental health. Ladies and gentlemen, here's a video message from Dr. Mofokeng, stressing the right for health for everyone.
Distinguished guests and colleagues, it is an honor to address you today in the framework of the European Microfinance Award ceremony. I wish to thank the government of Luxembourg for inviting me to participate in this important event, which this year focuses on inclusive finance and healthcare, a topic critical in my mandate. Distinguished colleagues, the right to health is recognized in numerous international and regional human rights instruments. Article 12.1 of the International Covenant on Economic, Social, and Cultural Rights, which provides the most comprehensive provision in international human rights law, recognizes the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. As classified by the Committee on Economic, Social, and Cultural Rights, the right to health is not to be understood as a right to be healthy. The right contains freedoms such as the right to control one's health and body, and entitlements such as the right to a system of health protection and to a variety of facilities, goods, services, and conditions necessary for the realization of the highest attainable standard of health. Importantly, it extends to the underlying determinants of health, such as access to water, sanitation, food, nutrition, and housing, healthy occupational and environmental conditions, and health-related education. I cannot emphasize enough that with respect to the right to health, equality of access to healthcare and health services is critical. Everyone has a right to health and to be treated with respect, dignity, and equality. This is regardless of gender, sexuality, race, nationality, drug use, legal or health status, such as the mental health or any other ground. However, as I have put forward in my first statement at the General Assembly in 2020, the starting point of millions of people around the globe is unequal, and root causes of this inequality lies in patriarchy, in slavery, in colonialism, in apartheid, and neocolonialism. All systems that occur simultaneously, that are anchored in discriminatory practices and have negative and disproportionate impact on women, queer people, gender diverse people and non-conforming people, Black people and people of African descent, and other persecuted racial, ethnic, and religious groups, indigenous people, people with disabilities, migrant communities, and indigenous communities. And this inequality affects an individual's level of enjoyment of the right to health, and in particular, an individual's access to healthcare facilities, goods, and services, and to the determinants of health, which in turn affect the individual's health outcomes. Therefore, the adverse health outcomes are not only about individual predisposition or genetics, but also about oppressive systems that established racial, socioeconomic, gender, and other hierarchies which enable enduring social discrimination beyond formal colonial structures and have continued to perpetuate current health inequalities. And at the same time, those who are marginalized or in vulnerable situations or living in financially precarious situations, usually outside social protection mechanisms, or are sometimes criminalized, whether in high, middle, or low income countries, face additional barriers to health access and to healthcare facilities, to goods, to services, and the underlying determinants of health. Now, COVID-19 has only further exacerbated these existing inequalities. Distinguished guests and colleagues, more than ever, being aware of these inequalities is imperative to building solutions for improving access by all to healthcare and to the determinants of health, mental and otherwise. because both these causes and the symptoms must be addressed in order to achieve holistic health. And echoing the 2012 report of the mandate, I would like to recall that full realization of the right to health is contingent upon the availability of adequate, equitable, and sustainable financing for health at both domestic and international levels. And so in this connection, I would like to stress that under the right to health framework, states have the obligation to make use of maximum available resources to ensure full realization of the right to health and to take the necessary steps to raise adequate revenue, mobilize resources for health, and ensure that health financing is correspondingly prioritized in national and subnational budgets. And I think COVID-19 is a lesson in how much or how successful we were in these plans. Now, the right to health approach recognizes also the essential role that international assistance plays in ensuring that adequate funds and resources are available for health globally, particularly in the so-called developing countries, and requires states to cooperate internationally in order to ensure the availability of sustainable international funding for health. And in so doing, donor states, multilateral donors, and philanthropy must be guided by a right to health approach and allocate funds based on the needs identified by those who are in the receiving end of those funds. And it must be on the basis of human rights, equality, and non-discrimination. I also urge states to strive to be less dependent on donor aid in order to meet their obligation. Much of the obligations, especially on sexual and reproductive health rights and those services related, are still very much dependent on donor aid and philanthropy. And I note with concern that funding of 30% of health spending in low-income countries and over half of the health spending of 4 low-income countries come from donor funding and from national governments and multilateral donors and philanthropy. So in striving towards realizing the right to health for all, when we are striving for universal health coverage, it becomes important that the approaches that we take must take into account the plurality of human experiences, and these must remain a priority of states in their endeavors to respect, fulfill, and protect the right to health for all. And equality must be understood in the context of the historical injustices that necessitate them. And so as we look forward to universal health coverage, health insurance, and the current needs imposed on us by COVID-19, we have to remember that solutions aimed at achieving equality cannot be ignorant to the position within the social power matrix of the people they want to serve. And with that, I would like to thank you very much once again for this opportunity to join me for this very, very important European Microfinance Award ceremony. And congratulations to everyone involved. And thank you again to the government of Luxembourg for this invitation.
Thank you, Dr. Mofokeng, for being with us today, and greetings to South Africa. Time to look now back and to get some news from last year's winner. The theme in 2020 was encouraging effective and inclusive savings, and the winner came from Nepal. The development bank Muktinath Bikas Bank Limited won the award in recognition for its solidarity-based group savings model. Muktinath serves in low-income households and women in rural areas. It has tailored a collective and solidarity savings model with doorsteps collections. Their products include retirement savings plans, insurance plans, and savings schemes. They are specifically designed for migrant workers and the families they left behind in Nepal. And I'm now connected with Govinda Raut, Assistant CEO at Muktinath Bikas Bank. Mr. Raut, what was the impact of the European Microfinance Award on your organization?
Yeah, definitely, our vision is still intact with us, and we are thinking to promote even more mobile banking. That is the future of our digital transaction. And in addition to that, we are thinking to onboard third-party payment system in our network so that our rural people, they are able to deposit and withdraw their money in a convenient way, and they do not need to come to branch office or the travel even more. They can find the nearby third-party agent for mobilizing deposits or provide some withdrawal facilities. We have been thinking, and in addition to that, as we envisioned in our plan, we are going to scale up our financial literacy program as well as the digitalization in our operation. And about the digital villages, we have been identified some couple of villages that we are going to visit in that place very soon, and in those villages we are trying to materialize our envision in the reality. We will continue all the activities that related to digitalization and reaching to the poor people. Definitely we will continue.
Thank you, Mr. Rauch, encouraging excellent news. It's good to hear some positive feedback. And before meeting with this year's finalist, let's listen to another expert voice. Craig Churchill is the chief of the Social Finance Program and team leader of the International Labour Organization's Impact Insurance Facility. Craig Churchill has more than 2 decades of microfinance experience, both in developed and developing countries. In his current position, he focuses on the potential of financial services and policies to achieve social objectives. He serves also on the governing board of the Access to Insurance Initiative, and he was the founding chair of the Micro Insurance Network. Ladies and gentlemen, please welcome with me, straight from Geneva, Craig Churchill.
Thank you very much for that kind introduction. Aha.
You're welcome. We're happy that you're here today.
Yes, first time I've gone anywhere for work in almost 2 years. So it's exciting for me to be here. So thank you for giving me an opportunity to get out of Geneva and come visit Luxembourg.
Yeah, and it's great that we have this wonderful audience.
So the financial inclusion community has long recognized that financial services that the providers are offering are intended to achieve a particular objective. The original idea of microfinance, namely to provide loans to microenterprises, remains an important part of the agenda in the effort to support economic growth and promote social justice in financial markets. But anyone who's worked with small businesses recognizes that this is not sufficient. Microenterprises and the entrepreneurs and workers in those businesses need a variety of financial and non-financial services to achieve a whole host of different objectives. To that end, I want to applaud the organizers of the European Microfinance Award, the European Microfinance Platform, the Inclusive Finance Network, and Luxembourg Aid and Development. Over the years, you have highlighted a myriad of ways in which financial inclusion can contribute to social and economic development, including housing, food security, and resilience to climate change. This year, the organizers picked one of the most critical topics, financial inclusion and healthcare. Of course, because of the COVID pandemic, it's particularly important. But to be honest, it has always been a critical issue, just not one that financial service providers have necessarily focused on. As we've heard in recent past few days, for low-income households, ill health can be financially catastrophic, eroding savings, depleting working capital, and exacerbating indebtedness. Health-related financial risks are a primary driver of impoverishment. The WHO estimated that about 150 million people around the world suffer financial catastrophe annually from out-of-pocket expenses on healthcare, and while 100 million people are pushed below the poverty line. And that data was from before COVID, so it's fair to assume that it's gotten worse. Unless health issues are addressed, the impact promised by access to finance will indeed be limited. Any gains to income and assets through business growth can be wiped out by a health incident. For low-income households to avert poverty, they need family members who are healthy enough for long enough to be economically active to accumulate wealth and thus financial resilience. If the breadwinners operate or work in small businesses, those businesses need a healthy workforce to remain sustainable and grow. So how can financial service providers facilitate access to healthcare? This is the really thrilling aspect of this award. By launching an open nominating process without stipulating how the healthcare goals are achieved, it enables the financial service providers to highlight their creativity and display the vast array of interventions that they have implemented to enable low-income households to access healthcare. From a review of the projects submitted for consideration, the applicants have risen to the occasion with a whole variety of interventions and approaches. One might expect that health insurance would be the main approach used by financial service providers. And surely it is a common mechanism, but it isn't for everyone. Indeed, an exciting aspect of the healthcare agenda is that the entire core business of financial service providers, savings, credit, and insurance, can contribute in some way to facilitating access to healthcare. While insurance gets most of the attention on this topic, I want to put in a special plug for savings. Major health expenses occur infrequently and are best addressed through insurance. But the lion's share of health expenses are smaller and more frequent. For these costs, a health savings account could be an ideal solution. These accounts are semi-liquid and can be accessed when people have a health expense, and therefore, from the client's perspective, saving is the most flexible and the most affordable solution. But wait, there's more. Financial service providers have other ways of impacting the health of their clients besides savings, credit, and insurance. As Dr. Mafokeng just mentioned, the Sustainable Development Goal on Health and Well-being, SDG 3, focused quite explicitly on achieving universal health coverage. Many governments are pursuing this objective quite seriously, but they often encounter challenges in enrolling population segments that work in the informal economy, which is the target market for most microfinance institutions. Consequently, one of the most impactful ways in which financial inclusion can contribute to health outcomes is when MFIs help their clients to enroll in national schemes where they exist, which might involve some sort of premium financing arrangement. To figure out what intervention will be the most impactful, the starting point is to understand what health risks are most prevalent and troubling for one's clients, and then to identify the means for tackling those risks. For some organizations, that might be something basic, like providing information about preventable illnesses, distributing bed nets, or organizing healthcare camps so clients can get their annual checkups and vaccinations. Or it might go to the other extreme, to actually offer healthcare itself, as we have seen some of the financial service providers do, either on their own or through a sister organization. The approach might also involve targeting a specific health issue, like pregnancy or newborn care, or like cervical cancer targeted by Crissair in Bolivia. The approach might involve filling in some gaps in available services, like providing transport to healthcare facilities, which is a particularly important issue in rural areas, or negotiating discounted pharmaceuticals, or offering a hospital cash insurance product that pays a daily amount for each day you're in the hospital, which is essentially an income replacement scheme for people running their own businesses. The range of possibilities is quite mind-boggling. For many of these interventions, one of the keys to success in facilitating access to healthcare is through partnerships. Healthcare is not an area of expertise for most financial service providers, but if they partner with the right organization, they'll be able to achieve a significant impact in their clients' lives. Partnering with a national health insurance scheme would be, by far, the most impactful, but not all countries are moving in this direction. We also see collaboration with insurance companies, healthcare providers, telemedicine providers, pharmacies, and the like. These are important steps to promoting better health. But before concluding, I want to say a few words about the business case. While many MFIs have a double bottom line to achieve financial and social objectives, if the health intervention is a big drain on revenue, it will create an imbalance between the two. There are ways to identify low-cost interventions that have a big impact. And the health activities are designed, and some health activities can even be designed to generate income, such as commissions from selling insurance. But it's important to recognize from the viewpoint of the financial service providers that keeping clients healthy makes business sense. Healthy and economically active clients are less likely to default on loan repayments and may earn and save more. I hope that the attention on this critical topic that has been raised by the European Microfinance Award will give more financial service providers pause to think about how they can help the working poor to manage and finance their health risks more effectively. I hope that they will be inspired by the exciting and innovative work being undertaken by these 3 finalists, as well as the many other organizations that submitted applications. What we have on the table is an important start, but we need to get more financial service providers engaged to satisfy the demand on the ground. Thank you.
Thank you very much, Craig Churchill. Do you know how many projects are competing for the award that we are handing out today? Any idea? This year's edition of Inclusive Finance and Healthcare has received 43 applications from 32 countries. And out of these applications, a selection committee composed by financial inclusion specialists selected 10 semi-finalists. And all of them are showcased in this special publication of the European Microfinance platform, and those who will follow us digitally, they can download it right now on the left-hand side of the screen. And among these 10 semi-finalists that you find in this publication are the 3 finalists that are competing today for our €100,000 award. And we will also have 2 runners-up who will receive €10,000 each. So who are these 3 finalists? Ready? Ready? I see they are already connected. And our first finalist is Crissair, AFD from Bolivia. And they were selected in recognition for its cervical cancer screening and treatment program for rural women. Our second finalist is Dreamlopments Limited from Thailand, selected in recognition for its M-Fund health microinsurance for migrant families and border communities. And our third finalist is Fonconze from Haiti, selected in recognition for its Boutique Santé initiative to train clients, to provide screenings and health education. And we'll now go immediately live to Bolivia to our first finalist, Crissair, represented by Mrs. Isabel Rueda Fiandes, its development director. Ms. Fernandez, can you tell us your reaction when you were shortlisted for this year's European Microfinance Award? Do you hear us?
Muy buenos días desde Bolivia. Un saludo especial y el agradecimiento en primera instancia a los organizadores. El momento en que recibimos la noticia me emocioné muchísimo. Sentí que el trabajo que se hace en Crissair y con responsabilidad y compromiso realmente tiene incidencia. Pensé inmediatamente en las mujeres que salvaron sus vidas, que están vivas en este momento y que gracias a ellas el programa ha tenido sentido. Pensé que en el trabajo que realiza Crissair tiene un verdadero impacto cuando se llega a las mujeres, sobre todo más vulnerables y más pobres, estas mujeres bolivianas. El mejor regalo es la vida, y debemos hacer todo para mejorar su calidad, especialmente de las personas más vulnerables de mi país. Me sentí muy orgullosa de trabajar en Crissair y formar parte de este programa. Esta noticia también me ayudó a reflexionar sobre la importancia y el compromiso que debe tener y tiene en este momento los directivos y la alta gerencia de la organización. Sin su dirección de ellos, sin la estrategia que ellos dan a la organización, esto no hubiera sido posible. Finalmente, quiero mencionar a cada uno de mis colegas que trabajan día a día para que este trabajo tenga su resultado. Son aquellos que están en el campo convenciendo, educando a las mujeres por la importancia de prevenir esta enfermedad que es el cáncer de cuello uterino. Muchas gracias.
Yeah, fantastic. And because you have an impact, you were selected. Crissair is a Bolivian non-bank financial institution which operates with a village bank methodology. It offers savings and credit services to women in poor and remote communities, as well as educational and community development services. Let's have a look at how they do this.
Bolivia es un país con mucha diversidad geográfica, ¿no? Y cultural también. Entonces, cuando vamos a visitar a las clientes, a las socias, nosotros a veces tenemos que pasar distancias muy largas. Tenemos en Crissair alrededor de 240,000 clientes. El 80% son mujeres y estas mujeres están ubicadas en las zonas rurales o en las zonas alejadas o periurbanas.
Yo me llamo Domitila Condori. Crissair para mí es un apoyo grande. Los asesores nos han enseñado muchas cosas. Cómo se guarda la plata, o cómo puedes ahorrar, o cómo puedes guardar para tus hijos, qué es lo que puedes hacer. Todo eso nos ha enseñado.
Desde el inicio, Crissair tuvo siempre una especie de dos brazos, ¿no? Uno el área financiera y el otro el área educativa. El área financiera es porque trabajamos con gente con bajos recursos económicos y entonces hay que dar dinero a las personas para que puedan emprender un negocio. Pero a la vez no solo es el dinero, necesitamos educar a las personas y las mujeres necesitamos educarnos más aún por las condiciones que existen en el país.
Mi nombre es Concepción Villarreal Monroy y soy socia de Crissair. Sacamos un crédito para mi tienda y para mi pensión. Es una banca que confía en las socias. No podemos sacar fácilmente de un banco grande porque te piden muchos requisitos. En cambio, Crissair, formamos un grupo, entonces nos garantizamos entre todas las socias.
Estamos ayudando al desarrollo del país porque cuando se capacita y se atiende a una mujer, estás logrando capacitar a toda una generación. Yo espero que continúe en décadas y podamos sacar adelante el país.
And Bolivia is one of the world's countries with the highest cervical cancer rates. And cervical cancer is the leading cause of death among Bolivian women and especially young women, while most deaths could be avoided by preventing screening and treatment. Most access to those services is very limited, particularly in the most remote areas. Let's have a look at a testimonial by affected women.
Yo me llamo Estela Mamani Castillo, pertenezco a Crissair, a la banca comunal. Tengo 5 hijos, mi esposo y yo. Hago tejidos y el crédito que sacamos es para levantar nuestro negocio.
Crissair es una institución especializada en microfinanzas y articula los servicios de microcrédito con servicios de educación fundamentalmente y de salud. Es a partir del año 2003 cuando llegamos al convencimiento de que teníamos que tener una intervención en el cáncer cérvico-uterino porque era la principal razón de mortalidad femenina. 4 a 5 mujeres día morían en nuestro país por esta causa.
Y nos dijo, sí o sí, deberíamos de ir todas a hacernos nuestro papá Nicolau, cosa que yo nunca me había hecho el papá Nicolau. Y cuando la doctora Vania me dio la mala noticia de que yo tenía precancerígeno, ya para mí fue tan doloroso No, hasta el día de hoy lo recuerdo así. Era tan doloroso para mí, era como si ahí se acabara todo.
El 80% de este tipo de enfermedades se ha detectado en estratos socioeconómicos bajos. Nosotros somos 12 médicos que trabajamos con la institución Crissair. Lo que hacemos son programas de cada mes de viajes al área rural. El cáncer de cuello uterino es uno de los pocos cánceres que se puede detectar en estadios tempranos y tiene cura, ¿no? Si nosotros lo hacemos el tratamiento en estadios tempranos.
Con mi experiencia, mis compañeras desde esa vez, ya como han visto mi historia, me han visto a mí como yo lloraba, y entonces desde ese día al pie de la letra, todas vamos de la doctora Vania a hacer nuestro papá Nicola. Ahora más bien, gracias a Dios, estoy bien.
Ms. Fernandez, did you experience any difficulties approaching these women and convincing them to accept preventive care?
Sí, en nuestro país hay muchas dificultades para que las mujeres accedan a realizarse una prueba preventiva, ¿no? Menciono solo algunos de ellos, ¿no? Hay poco acceso a los servicios de salud, sobre todo en las zonas rurales y alejadas del país. Los costos son altos si es que la gente quiere ir a un servicio privado. Varias mujeres prefieren no ir al centro de salud porque a veces no reciben un trato igualitario por sus prejuicios, por miedo, por vergüenza. Estas pruebas para prevenir el cáncer de cuello uterino son invasivas a la intimidad de las mujeres. Entonces, a veces la mujer prefiere no ir. Algunas de ellas buscan que las personas que las atiendan, los médicos, sean mujeres, pero son muy pocas las médicas mujeres que quieran o puedan desplazarse hasta las zonas rurales y más alejadas del país. El machismo, la discriminación también a la mujer, la falta de autoestima de la propia mujer, el nivel educativo, las creencias culturales, las costumbres y mitos son otras razones que frenan para que las mujeres tomen acciones preventivas. Crissair está trabajando por varios años ya, más de una década, focalizando este trabajo para sensibilizar a las mujeres, capacitarlas, educarlas, no solamente a ellas, sino también a sus parejas, porque este es un trabajo integral. Se informa, se capacita y luego se les da la posibilidad de tener acceso a los servicios médicos, como ustedes han visto en el video, a esta doctora, donde llevamos a las zonas más alejadas del país a estos médicos. La capacitación y la educación es fundamental para que las mujeres desarrollen acciones preventivas en el futuro. Gracias.
Yeah, thank you. Thank you for being with us today, and thank you for all those explanations. We will see you in a little bit. Up next is our second finalist, Dreamlopmans, a non-profit social enterprise and foundation, and they are running 2 development projects for migrant workers and border communities in Thailand and Myanmar. And let's have a closer look immediately at what Dreamlopmans do.
ကျွန်မနာမည်နေဝဲမှာကျွန်မတို့ဗမာပြည်အပေါင်မြို့နယ်မုတ်တမမှာနေတော့ကျွန်မတို့တွေလည်း34နှစ်မှာမဲဆောက်ပြောင်းလာပြီးတော့အလုပ်လုပ်တယ်အလုပ်လိုက်ရှာတယ်မရတော့အမိုက်ပဲခောက်စားတော့အောက်ပြီးလို့ရှိရင်ရတဲ့ခါဆိုလဲ300ရတယ်မရတဲ့ခါဆိုလဲ150နဲ့ဘယ်လိုလဲရတယ်စီးကျိုတေးတူရှိတယ် တို့ရှိတယ်ဆိုတော့ဒါပုံမှန်စိတ်စားရတော့မှာပေါ့နော်ပုံမှန်စိတ်စားရတော့မှာဆိုတော့ဆရာဝန်တပြိုင်လည်းကျွန်တော်မတန်းနိုင်ဘူးမတန်းနိုင်တော့အပြင်မှာသူများတွေအဖန်ကားရှိလောက်ပြောတော့ကျွန်မစုံစမ်းပြီးလိုက်လောက်တာပေါ့လိုက်လောက်ပြီးအိုက်ဖန်ကနေစိတ်ကူတော့
In Thailand, universal healthcare is very, very good for their citizens and also the registered migrants. Unfortunately, the migrant families also follows to their husbands or brothers or sister and so on, and there is no health coverage. So MFund allow them to pay for the small fees. It's 100 bahts, equivalent of the somewhere around 2.6 euro that they can pay for the every monthly fees. And then Infant provided the state-of-the-art, the excellence primary and tertiary care services. We are now more than 147 health facilities in Thailand and in also Myanmar.
ဘာမလုပ်ခင်ဆိုရင်ကျမတို့ကဆေးကိုပြလိုက်မပြလိုက်ဒါလည်းမှယောဂပဲတိုးတော့ဘာလုပ်ပြီးတော့အချိန်မှကြတော့ကျမတို့အဆင်ပြေတာပေါ့ဆေးရုံသွားဆေးကလည်းသွားတာလွယ်ကူတယ်ဆေးလည်းပုံမှန်စားရတာပေါ့
And we'll get to know more about Infant later, but Ms. Nicolas Durier, could you tell me what was your reaction when you were selected as a finalist of this year's European Microfinance Awards edition?
Thank you, and good evening, good afternoon, and good morning, everyone. Well, when we learned that we were shortlisted as one finalist, we were really excited, and I must say also honored. Having made it to the final of this prestigious award is, yes, an honor and also a great opportunity in itself. Regardless of whether or not we will get the first prize, being a finalist of this prestigious award is already in itself a great support to our mission. It will increase, further strengthen our credibility, our visibility, and perhaps raise opportunities for new partnerships. So on behalf of all staff in the organization and the project, I would like to very warmly thank the organizers of this award, the European Microfinance Platform, Infine Luxembourg, and the government of Luxembourg for having us participate in this award and reaching the final. Thank you very, very much.
Before I'll ask my second question, let's dive deeper into understanding what the M-Fund Health Micro-Insurance does for migrant families and border communities.
ထိုင်းနိုင်ငံရောက်တော့ကျွန်တော်2000နဲ့လာတယ် community ကိုခါတော့ကျွန်တော်2010ခုပေါ့နော်8လပိုင်းလောက်စပြီးတော့ကျွန်တော်ဒီသူကလည်းကျွန်တော်ဟိုလူလလာနဲ့ဒီလုံးမနေလုံးမဆိုရင်နေအတွက်နဲ့တင့်ရော်တယ်တခြားလူတွေနဲ့အတူပေါ့နော်ထိုင်းလူမျိုးတွေနဲ့အတူဆေးရုံဆေးကမှကျွန်တော်တို့ဆေးကူတာမှုရှိအောင်လက်လန်းမြော်ဆိုတော့ပေါ့နော်ကျွန်တော်တို့အဲ့ဒီအကြောင်းကိုကျွန်တော်တို့ရှင်းပြရတယ်ဖြစ်မဲ့ကျွန်တော်တို့စိတ်ဝင်စားတဲ့ရွှေ့ပြောင်းမြန်မာလူသမားတွေကိုကျွန်တော်စီယိုလို့ဆိုရတယ်ပြီးလို့ရှိရင်ကျွန်တော်တို့အန်ဖန်ရဲ့အကြောင်းကိုကျွန်တော်တို့ဘယ်လိုပြောမလဲသူတို့နားလည်အောင်ကျွန်တော်တို့ရှင်းပြတယ်အာသာချက်ဒါမှမဟုတ်ရှိလို့ရှိရင်အားနေချက်ပေါ့နော်ဒီကျွန်တော်တို့တစုံတစ်ခုတမီးအဖန်ကိုရက်ကွက်ကိုယ်စလဲကနေတည်ရပါတမီးကိုဝင်အခုဆို8လရှိပါပြီတမီးကိုဝင်လောက်တာအဖန်ကနဲ့ပေါ့နော်အဖန်ကန်းယုံမှာအဲ့ဒီအဖန်ကန်းကနေတဆင်တမီးကိုဝင်စေကမ်းမှာတပြားရတာပေါ့နော်တမီးအနေနဲ့တော့အဖန်ဝင်လာတာတော့အရေးကြီးတယ်တမီးတို့ရွှေ့ပြောင်းမြန်မာပြည်သားတွေအတွက်လည်းပို့ပြီးအထောက်အကူရတာပေါ့နော်
Medical Clinic has been providing primary health service for vulnerable population along the Thailand-Burma border since 1989, and most of our patients doesn't have legal documents or health insurance. Today, almost 60% of our pregnant women enroll in Infant so that they can get primary care service. ကျွန်တော်တို့အန်ဖန်အဖွဲ့အစည်းလိုမျိုးတခြားပဲအဖွဲ့အစည်းမှလည်းမရှိဘူးပေါ့နော်ဒီကျွန်တော်သားသမီးတွေပေါ့နော်ပြီးလို့ရှိရင်ကျွန်တော်မျိုးသမီးတွေကျွန်တော်မိသားစုတွေကျွန်တော်ကိုယ်တိုင်လည်းအန်ဖန်ရဲ့ဟောလို့ပြောမလဲအသင်းဝင်တယောက်ပေါ့နော်ကျွန်တော်လည်းကိုယ်နေမှာဒါတော့ပူပေါင်းပဝင်ကူညီတဲ့နေနဲ့ပါရက်ကွက်တော့မှသွားတဲ့ခါကျရင်ကိုတိုင်ဝန်ထမ်းတယောက်တော့မှဒီဟာလေးလည်းလှုပ်ထားနေဆိုတော့အကြောင်းနည်းနည်းကိုကြွားရှင်းတော့နေ့လည်းဖြစ်မယ်3နေ့လည်းဖြစ်မယ်အနည်းဆုံးတော့ကျွန်တော်ဒီမှာ
Nicolas Durier, what were the challenges that Dreamlopments faced while implementing the M-Fund, and how did you overcome them?
Well, we have faced many challenges over the past 4 years since we started the project. In recent times, undoubtedly, it has been the COVID crisis. COVID has very heavily impacted the lives of migrants in Thailand. Many have lost their jobs and have no safety nets. So for us, it was hard to best continue protection of our members and as well continue to protect the project. So how we responded to this is that during 3 targeted periods of time during the 3 waves of COVID, we decided to subsidize the membership contribution of our members so that first we could maintain their health protection and we could also protect the project. We did that thanks to some financial support from our donors, but we also tapped into some small financial reserves that we have built over time. At the same time, we faced increasing cost of healthcare in the last month of June, July, August. But things have gone better since then, and I am cautiously optimistic that we have gone through that. So this is one challenge. But then since the beginning, I think that one key challenge for us has been to, on one hand, maximize the healthcare benefit and the protection of our members, while at the same time working to build the financial sustainability of the project, which are not necessarily aligned objectives. And we have made great progress towards that goal already, but this remains an ongoing challenge for us.
So good luck with your challenges. Courage to you. And thank you for sharing your experiences, and stay online. We'll see you again in a little while. Our third finalist joins us from Haiti. Fonkoze is a family of 3 organizations whose collective mission is to provide financial and non-financial services to empower Haitians, primarily women, to lift their families out of poverty. One of the organizations is the leading microcredit provider. Its non-profit sister, the Fonkoze Foundation, complements these microcredits by providing additional support in some of the most isolated areas of Haiti. They offer health screenings, guidelines, and other development services. And live from Haiti, it is Karine Reunen, the executive director, who is now joining us. Ms. Ronan, what was your reaction when you were nominated as a finalist for this year's edition of the European Microfinance Award? Oh, we've lost her. Oh, too bad. No, you're there? You're there? Yes, can you hear me?
I can hear you.
You can hear me? We hear you, so you can answer.
I can hear you, no problem, but my signal is iffy.
Yeah, the signal is weak, but it still works. It still works. So you can just answer my question. You can answer the question. What was your reaction when you heard that you were nominated today for this award?
Okay, so greetings from Port-au-Prince, everyone. We were very proud when we heard that we had been selected as finalists for the European Microfinance Award. As you may know, the real difficulties in terms of insecurity and in terms of access to fuel cause a lot of trouble with our day-to-day activities in Haiti these days. So having our work recognized by the Microfinance Award team was really, really encouraging to us. And honestly, I think when we share this news, when we tell our community health entrepreneurs about this award, they will be very proud too. It's the community health entrepreneurs who allowed us to provide healthcare to 11,000 malnourished children, who distribute paracetamol, condoms, iodized salt in their communities, and who screened over 10,000 people for hypertension over the past year. They are really the core and the heart of our Boutique Santé initiatives. So in their name and in the name of my colleagues, I thank you all very much for your interest and for your support. It gives us courage to continue working with our clients to keep them and their families healthy.
Yeah, and courage is very important. In rural Haiti, the mortality rate of children under the age of 5 is 81 out of 1,000 births. And the stunting rate is 22% for children, and only 23% of the rural population uses improved sanitation. And here's a video on some of Fonconte's activities and how they want to improve health in Haiti.
Dans le travail Foncoze, moi remèm pour nous capable aider moun qui dans zone rekile yo, qui pas gen moyen yo, nous porter la santé pour yo. Nous porter produits de qualité pour yo. Produits ça yo tout, nous gen, moun n'a pas besoin courir aller l'hôpital parce que zone côté lié pas de joindre l'hôpital, mais s'il te gen paracétamol là, li te gen yon ibuprofène, li te gen yon almacide là qui te prel, li t'a senti l'a soulagé.
Boutique Santé est une initiative de Foncoze pour rendre disponibles les produits essentiels de santé dans les zones reculées du pays. Nous travaillons d'abord avec les chefs de centres de crédit du réseau Foncoze. Nous les habilitons, nous les formons sur des thèmes de santé prioritaires du ministère de la Santé publique. Nous exécutons un projet de nutrition. Nous avons dépisté plus de 800 000 enfants moins de 5 ans. Ensuite, nous mettons disponibles les produits de santé essentiels dans les branches. Comme ça, ces chefs de santé-là peuvent venir s'approvisionner régulièrement et aller revendre ces produits dans leurs localités respectives.
Satisfaction, c'est parce que l'ENTAP travaille ensemble avec Timoun malnutri yo. Nous faisons faire dépistage là. Chef centre là, nous référons Timoun yo, ou Timoun yo vin guéri.
Ms. Ronan, in this difficult context of Haiti, what were the lessons that you learned implementing the program Boutique Santé?
The first lesson we learned is that you have to persevere. We actually at Foncoze started trying to integrate health programming for our microfinance clients since 2006. We had to test a variety of different models before we finally found Living Goods Community Health Entrepreneur model, adapted it to Haiti and started testing it in 2012. And it's only in 2014 that we really were ready to start scaling it up. So first lesson is you won't get it right from the first time. You really have to persevere. The second lesson is a bit in the same idea. It is that you have to have solid goals, know where you want to go. Like what we wanted to do is really facilitate access to essential healthcare services for our clients so that they can succeed with their businesses. But you have to be very flexible with the strategy you're going to use. In an environment like Haiti, you have to be able to adapt your strategy as you go. Like, for example, initially, our plan was to work with the community health entrepreneurs, but to have a partner take care of all the logistics and purchasing. In the end, we couldn't find a partner who knew the rural areas of Haiti the way we do. And now we actually have to do the logistics and purchasing ourselves too. The last lesson is a lesson we learned from our own clients. When the environment is as uncertain as it is in Haiti, one must diversify in order to survive. We diversify the areas where we work in so that when one branch is inaccessible because the road is blocked, we can work with another branch. We diversify the products and sources of products that we provide to our entrepreneurs because when one supplier is out of stock, we can find the product elsewhere. We also diversify the type of products that the community health entrepreneurs distribute so that, for example, they can sell services measuring hypertension and temperature for their neighbors when they're out of stock because the road is blocked and we can't provide them with products. So overall, the lesson is you're never really there. It's a constant process of adapting, learning, and adapting again.
Yeah, thank you, Ms. Runen, for this interview and for your perseverance. I suggest that we watch another video to see an example of a boutique santé program.
Moi, c'était Avenue Michelin. Situation, comment lié? Mon cas dit que c'est ça. Puis, la difficulté nous joindre, c'est les gens qui malnutris. C'est difficulté ça nous joindre parce que là, aller dans souterrain ou jeune petit monde les malades. Faut qu'on même prenne responsabilité. Si petit monde aller à l'hôpital 2 fois par semaine, par mois ou bien 3 fois, ou même on doit être au engagement. Faut qu'on prenne engagement pour jeune avec parents ça, non seulement pour faire formation pour lui, leur finir pour transmettre l'hôpital, pour y aller et faut qu'on toujours passer ouais est-ce que ti moun nan li prend médicament ou attend, est-ce que li changer par rapport avec Jean Théoul là. Li pas facile du tout.
Bon, on pas faire rien pour me vivre. M'ba nan rien, m'ba nan ti job, pas rien pour nous vivre. Ça fait les difficile pour nous joindre santé parce qu'il n'y a pas de l'hôpital pour nous, pas rien qui pourrait nous voir ici parce que nous sommes dans un lieu isolé. Mademoiselle Michelin portait un pile expérience pour nous. Tu as apporté un pile expérience pour moi. Dis montrer comment pour me servir avec comment pour me baigner comment pour aller à l'hôpital avec yo. Quand porter petit de l'eau aquafine pour moi, il portait savon toilette. Il peut manger pour bébé. Quand si m'arrive un bébé, m'a dit couture merci avec nous toutes net.
C'est une satisfaction pour moi parce qu'il va te consulter, il va te consulter, mais quand même il vient changer complètement, il peut te marcher depuis le bébé me dit avec, mais je me sens fière parce que moi la vivre et maman elle dit tout. Après bon Dieu, c'est grâce avec action. Et en plus, moi-même, qui te prend engagement qui a fait le cas là, je dis.
Yeah, bringing hope and more. It's so important, and that is why we are here for today. A big thank you to all the finalists for your insights and your explanations, and we will see you in a bit when the winner will be announced. First, a few words on the selection process of this award. A high jury selects the winner among our 3 finalists, and it is composed of experts in financial inclusion, experts in health, practitioners, and high-level political and public figures, and last year's winners. And the members of this year's high jury were Her Royal Highness the Grand Duchess of Luxembourg, who is the president of the High Jury. It's Minister Franz Fayot, Luxembourg's Minister for Development, Cooperation and Humanitarian Affairs. Dr. Werner Hoyer, President of the European Investment Bank. Mr. Craig Churchill, Chief of the Social Finance Programme at the International Labour Organization. Mr. Bobby Gray, Research Director at Gray Mean Foundation. Mrs. Laura Hamricker, Chairwoman of the European Microfinance Platform. Last year's winner, Pradi Yuman Prokarel from the Muktinat Bikas Bank. And this high jury was chaired, as you know, by Her Royal Highness the Grand Duchess of Luxembourg. And we are very, very honored that she is present today and that she will announce this year's winner. But before that, she has an important message to share with us. Ladies and gentlemen, please welcome Her Royal Highness the Grand Duchess of Luxembourg.
Je vais faire ma première partie en français, quelques pensées à partager avec vous. D'abord, cher Monsieur le Ministre, chers membres du Grand Jury et chers amis présents aujourd'hui, à quel point je suis heureuse d'être là, d'être parmi vous et d'être parmi vous depuis tant d'années, d'être présente ici avec vous depuis tant d'années, de vous accompagner dans ce très beau prix dont je suis très fière du Luxembourg, de gouvernement, de tous ceux qui participent de l'aide au développement, de la Banque européenne. Et je suis à nouveau à vos côtés pour avancer sur tous ces problèmes. Ce qui me frappe et ressort pour moi, c'est ce qu'on dit en anglais, the lessons learned. Lessons learned des clients. Vous savez, j'ai toujours trouvé qu'il était très important, et c'est ce qui me plaît tant dans la microfinance, de s'informer auprès de ceux qui sont concernés par la problématique, d'être sur les terrains, d'être auprès de ceux qui ont le problème et de les écouter. Et ce que nous venons de voir de ces 3 projets qui sont les finalistes aujourd'hui, c'est exactement ça. Et c'est la force et la flexibilité de l'outil microfinance. C'est qu'on va sur le terrain, on voit quel est le problème des plus pauvres, on leur demande, on prend leur avis parce qu'ils savent mieux que personne ce dont ils ont besoin et ce qui leur manque. Et à partir de là, il y a la flexibilité de l'outil pour créer, pour avancer avec eux selon leurs besoins. On vient de l'entendre, on a eu des exemples très clairs. Le maître mot là-dedans, ce qui résume tout pour moi, la beauté aussi de l'outil microfinance, c'est le respect de l'autre et la dignité de l'autre. Comment l'aider à sortir de cette situation dans laquelle personne n'est par choix. Personne n'est pauvre par choix, personne n'est inéduqué par choix, personne n'est dans la misère par choix. Donc nous avons une responsabilité d'accompagnement et je suis très fière que notre pays et que notre prix le fasse. Je pense qu'ils ont, toutes ces personnes en situation de besoin, ont une grande intelligence et un grand savoir de comment s'en sortir. Et je suis très fière de nouveau que nous fassions ce pas pour les accompagner, et par les moyens financiers, et aussi par les best practices. Parce qu'en fait, cette année, nous avons reçu énormément de propositions et de candidats. Je vous avoue que c'était très difficile de faire un choix, parce que la diversité était très grande, mais aussi la qualité des projets était très grande aussi. Et donc, tout ça pour vous dire que ce que nous faisons ici avec ce prix et avec la microfinance en particulier est clé, est essentiel, parce qu'on oublie trop souvent que nous nous adressons à la majorité des êtres humains sur cette planète. Nous avons tendance à oublier que nous, les privilégiés que nous sommes la toute petite minorité, et que tous ces services auxquels tous ces êtres humains ont droit, que ce soit, comme vous en avez parlé, que ce soit dans le housing, food, health, éducation, quels que soient ses besoins, tout le monde a droit à avoir accès à cela, et la majorité des êtres humains sur cette planète n'y ont pas droit. Alors bravo pour ce que nous faisons. Je nous encourage à aller toujours plus loin et mieux. Et voilà. Et je termine là-dessus en vous disant que je suis encore une fois très fière et que partout où je vais, je parle de notre prix et de la manière dont notre pays s'implique dans le domaine de la microfinance et de l'aide aux plus vulnérables.
Thank you, Your Royal Highness, for these true words and the importance of our effort to push forward. And the moment that we have all been waiting for has now finally arrived. This trophy goes to the winner of the European Microfinance Award edition 2021. And they will receive also a financial reward of €100,000. And the great pleasure to announce the name of that winner.
So, dear friends, let's not keep you waiting any longer. The moment has come to announce the winner of the 12th edition of the European Microfinance Award for its collective mission to provide access to medical care, as well as financial and non-financial services to empower Haitians, mainly women, to lift their families out of poverty, I am delighted to congratulate Foncose as this year's European Microfinance Award winner. Congratulations. I sincerely hope the prize of 100,000 euros will allow you to strengthen your actions on the ground and develop your wonderful community health program in the very challenging and difficult circumstances that you are facing. So congratulations to you, and congratulations once more to all the finalists of the 2021 edition. Thank you very much.
Thank you, Your Royal Highness, for announcing the winner.
You're welcome.
And and I hope that Karine Runnen is still online. Did you expect to receive this fantastic trophy today?
Honestly, one always hopes, of course, but the programs by Dreamlopement and Crissair are so interesting and innovative and impactful. I would have had a very difficult time making a decision in the place of the grand jury. So to all of you, thank you very, very, very much. For the pleasure of being with you, for the honor of being a finalist with my two colleagues, and for the support. I'm sure it will help us improve Boutique Santé and get its benefits to more people in Haiti. Thank you very, very much. I'm very honored and proud.
Yeah, congratulations to you. Enjoy the prize.
I will.
Yeah, and we are at the end of the 12th edition of the European Microfinance Award ceremony. The focus of the 2022 edition next year will be inclusive finance for women. And again, congratulations to the winner and the two runners-up, and a big thank you to all those who participated to this edition. Stay safe, stay happy, and see you next year in 2022.